Welcome back to Houston Life. Open enrollment for 2026 individual and family health plans is underway now through January 15th. This is your chance to review marketplace options, compare costs, and make sure you are covered for checkups, screenings, and a whole lot more. Joining us is individual and family plan expert Jessie from Blue Cross Blue Shield of Texas with what we all need to know to choose confidently. Jessie, it's nice to see you. Thanks so much for your time today. This is kind of a critical time of year, right? Because plans, costs, and other factors can change year over year. Is that right?
That's right, Derek. The reality is plans can change yearly, and that can include your premiums and your deductibles and your networks and the drug lists. And of course, the status of your health can change too. And so understanding your options now to prevent surprises later is key. And you said it best. This is the annual open enrollment period that is running right now, and it ends January 15th. So this is our time to evaluate plan options and make elections based upon budget and health needs.
And so with that January 15th deadline, Jessie, that means right now there's wiggle room, right? So people can make adjustments, they can make changes up until that deadline, but not after that?
That's right.
Okay. And for people who out there are saying, well, why is having a health plan even important? Because I feel healthy, I feel fine, nothing is going to happen. I mean, I feel like the obvious thing is that we don't have a crystal ball. We don't know what's going to happen.
We don't. And it's important to have coverage because it protects you against the unexpected. We don't plan to get sick or have a medical condition, but when the unexpected happens, having health insurance can give us peace of mind. Coverage also means that you have access to preventive care and checkups, screenings and immunizations so that you can stay healthy.
Okay, so clearly there are risks of going without coverage, so a good plan can help protect you. But I get overwhelmed every single year when I'm reviewing plan options. I know I'm probably not alone. So how do people begin this process of figuring out what is a good plan for them and for their family and situation?
Well, first of all, finding the right plan means striking the balance of benefits and costs. Our individual and family plans focus on local care within the community that provides access to a broad network of providers. With multiple options, you can find reliable coverage that fits your needs and your budget. Plus, financial help can also be available. Many people qualify for subsidies with low or no cost premiums.
Oh, that's interesting. Okay, and when it comes to those subsidies with the lower cost premiums, how would someone begin to find out what they might qualify for, or to find a plan that fits both what they need but also what they can afford in their budget?
Well, Derek, I'm so glad that you asked. You can lean on the Blue Cross Blue Shield of Texas experts to learn more and find a plan that works best for you. For more information, we recommend going to mycardbcbstx.com. Again, that's mycardbcbstx.com, or calling us at 888-731-0317, and we'd be happy to help you walk through and evaluate your options so that you can find a plan that suits your needs.
And Jessie, before we let you go, is there any homework that we should be doing? Like, let's say I'm considering changing plans or updating coverage, or maybe I've had a change in my family status, right? Like maybe there's a new child or a new family member. Should we be making a list of, I don't know, medications that we take or doctors, providers who we like to have? Will that be helpful when we're comparing plans?
Absolutely. That is an important call out. When you're evaluating your options and trying to find a plan that works best for you, you want to consider a couple of things like, what are my health needs for the upcoming year? And have I had any changes in my own status or my family status? So making sure that your doctors are in network, that your prescription drug medications are covered by the plan that you're interested in is also important.
Okay, well, Jessie, I feel like 2025 flew by, and that January 15th deadline is right around the corner. And this is an important conversation to have, and a conversation we should be having with our loved ones as well.
That's right. That's right. So the key is don't wait to evaluate your options and to take action, because you have until January 15th.
Yeah, that deadline is coming, ready or not. Jessie, thank you so much for your time. Happy New Year as well. Hey, a reminder, open enrollment runs through January 15th for 2026 coverage. You can learn more about your options online at mycardbcbstx.com. You can also call 888-731-0317. And we will be right back with more Houston Life. Don't go away.